Namaskar. My name is Prasad. I am from the Gandhian movement. I live in Hyderabad. Recently, I had a problem with the heart and I was admitted to Apollo hospitals, which has given me a new lease of life. I am so grateful to Apollo for the wonderful treatment that was given to me. I consulted the cardiology department, Dr. Sreenivas Kumar, Dr. Soumen Devidutta, Dr. Sanjeev Kumar, nephrology, Dr. Somasekhar, Diabetologist, Dr. Ravi Sankar. My health, my treatment was into their hands. What Apollo has done to me is to give me an awareness, an understanding to change the lifestyle. I am now using the medicines prescribed very precisely, very meticulously, following the dietary restrictions or diet. Almost 40% of the food I am taking right now than what I used to take. Avoiding rice, avoiding fried items, avoiding pickles and things like that. Doing regular exercises to keep the body fit and also taking care of the sleep. These are the four things. So I'm able to take care of my health myself, and as a believer in the Gandhian philosophy, I think that your health should be in your own hands. That realization was given by the Apollo team of doctors. I'm so grateful for the various medical procedures, surgical procedures done to me, and the kind of nursing care that was given here. Yes, nursing care is there, but it is the motherly touch. Unusual, beautiful, most caring, concern they are shown. And when you are in the ICU, you're always tensed up. But Apollo has given me a feeling of being at home, and all the personnel here, whether it is a ward boy or a nurse attending on, the doctors and other people who are in the vicinity, they were the family for me. So now Apollo should work not only in the healthcare per se or the curative aspect, but also in the promotional. How do we create health awareness, health promotion, in addition to the preventive aspects in the large context of a country? The slogan of Apollo, live healthy, India, I think that's most appropriate. It is so well suited to create a healthy country, a healthy nation. I express my gratefulness, my gratitude to the entire team of Apollo doctors who treated me, mainly Dr. Sanjeev Kumar, Dr. Sreenivas Kumar, Dr. Soumen Devidutta, Dr. Somasekhar, Dr. Ravi Sankar, and all the people. I thank you all very much. Namaskar.
Hello, I'm Dr. Soumen, a cardiologist and cardiac electrophysiologist from Apollo Hospitals, Hyderabad. It's my absolute pleasure to tell you about Mr. Prasad, who was admitted with us not too long back. To be very brief about Mr. Prasad, he came to us in a very sick, moribund state. He had a history of coronary artery disease and had a couple of stents implanted a few years back. But unfortunately, he had again a set of progressive symptoms, primarily shortness of breath and severe fatigue on exercise, this time apparently related to a cardiac arrhythmia. Now, cardiac arrhythmia is a disease of cardiac rhythm or the cardiac beating or electrical system of the heart. His symptoms were rather very progressive, and he had a dramatic turn of his symptoms when he started suddenly blacking out. He started blacking out, technically we call them syncopal attacks, and on a couple of occasions he actually blacked out with severe facial injuries, so that was worrying. And now to make all these matters worse, because of this progressive shortness of breath and fatigue, and now these blackout episodes, he stopped walking, his mobility really got restricted, And that complicated his diabetes control. It really went out of control. Further, to make matters worse, he was really obese. He had a very poor sleep quality in the form of sleep apnea. Now, sleep apnea is a very grossly underrated and undertreated disease. It is essentially respiratory choking or obstruction of breathing in obese people, and that causes fractured poor sleep due to hypoxia. And that, unfortunately, in the long run leads to these cardiovascular illnesses and strokes and so on. I personally feel fundamentally his sleep apnea and overweight was related to his cardiac arrhythmia, which is causing all these symptoms. So he came to us in a rather moribund state. He just could not walk. He was almost persistently bedbound. He had lost hope that he could walk again. So when he came to us in this kind of state about a month back, fortunately for us, we could identify a cardiac arrhythmia which seemed to be causing all the symptoms. And that was potentially the starting point of his treatment. So after a couple of counseling sessions, we spoke to him about cardiac arrhythmia ablation, and he actually underwent a complex cardiac arrhythmia ablation procedure with a 3-dimensional navigation. And thankfully, it worked well. We could restore his normal rhythm. And that was a good start to his treatment. And after that, we started working on his rehabilitation. Now, we revisited his diabetes drugs. We were really counseled him hard about good proactive lifestyle with gradually increasing physical activity, a good light diet, and most importantly, sleep apnea and the need to resort to CPAP during sleep, which is continuous positive airway pressure. Fortunately for him, he was very receptive. He was very sincere in whatever we suggested. He took them, he absorbed them, not only in his medicines, the paramedical suggestions, that his diet, his exercise, even CPAP. And that's a very, I think that's a strong message to all our patients. It's not enough that you take medicines. It's also important that you participate in treatment, and by doing so, you do really help your physicians treat your diseases or illnesses really well, and he could do that. And we were absolutely pleasantly surprised a month later. When he just walked into the OPD, he looked a lot younger. He had lost 10 kilos. He looked fitter. He had a beaming smile. His diabetes and cholesterol were fully under control. And he just did not look the same person. In fact, I took a couple of seconds to recognize that it was him. And his beaming smile was a stark contrast to the moribund look that he had almost a month back. So essentially, friends, it tells us, and apart from the treatment, the high-end treatments that we do, the complex procedures that we do, which often do help patients, it's very easy for you to fall into this poor lifestyle. It's a progressive downhill, and if these risk factors, which is obesity, sleep apnea, diabetes, which are all interconnected with this inactive lifestyle, it can often lead to these kind of serious illnesses. And coronary artery disease, cardiac arrhythmia, strokes are to name a few. It can often really complicate your life, and Mr. Prasad was a great example of that. But that said, I'm really grateful to have this kind of satisfying and gratifying response in Mr. Prasad, something that we all physicians strive for in our work. And I really wish him well. I wish him that he continues his weight loss journey, his upward journey in health, and God bless him. Thank you all. Thanks for your patience.